Your shoes fit this morning. By 4 in the afternoon, they don't. You pull off your socks before bed, and there they are. Deep grooves pressed into your skin, right above the ankle bone. You press your thumb into the puffiness. The dent stays. 5 seconds. 10 seconds. It fills back in slowly, like memory foam that has lost its spring. You have mentioned this to your doctor. They checked your heart, ran blood work. Everything came back normal. You were told to elevate your feet and keep an eye on it. That was 6 months ago. The swelling is still there. Here is what the research has been saying, and what nobody at that appointment repeated. The number one cause of swollen ankles in adults over 50 is not heart failure. It is a condition in the veins of your legs that accounts for roughly 70% of every case. And it is a condition most doctors mention in passing, if at all. What follows is 5 hidden reasons fluid is pooling in your ankles. 5 causes that have almost nothing to do with the organ your doctor listened to. Stay through to number 1. That one is something you may have been handed at a pharmacy counter and told was going to help you. Every week on Inside Aging, we go through what the medical research actually says about aging, without the jargon, so you can walk into your next appointment with better questions. So what is actually going on inside your ankles? The answer starts with a phrase you have probably never heard your doctor say out loud. Chronic venous insufficiency. Doctors sometimes shorten it to CVI. In plain language, it means the veins in your legs are no longer holding blood the way they used to. The veins have to fight gravity. Every drop of blood in your ankles has to make it back up to your heart against the full weight of your body. They do that with tiny one-way valves inside each vein, little flaps that snap shut behind each pulse of blood, so it cannot slide back down. Over the decades, those valves wear out. They stop closing all the way. Blood starts slipping backward. It pools in the lower legs, and when blood pools, the pressure inside the vessels goes up. Fluid gets squeezed out of the vessels and into the tissue around your ankles. That is the puffiness you are feeling. That is the dent your thumb leaves behind. The Framingham Heart Study, one of the longest-running cardiovascular studies in medical history, tracked this. In men under 30, the risk of chronic venous insufficiency was about 1%. By age 70, it had climbed to 57%. For women, 77%. Venous insufficiency is not rare. Researchers estimate it affects 30 times more people than heart failure does. And yet, when you walk into a doctor's office with swollen ankles, the first thing they check is the organ that, statistically, is almost never the cause. If any of this is landing, if you are realizing nobody has ever laid this out for you in this much detail, take 1 second and hit the like button. When you do, YouTube pushes this video to thousands of other people over 60 who are quietly dealing with the same thing and being told the same non-answer. You could be the reason someone's mother finally understands why her ankles have been swelling for 3 years. That is not a small thing. Before we go any further, do something with me right now. This takes 15 seconds, and when you are done, you will have a personal number that tells you exactly how much fluid your ankles are holding. No equipment, just your thumb. Sit down, feet flat on the floor. Find the inside of your ankle, the bony bump on the inside, halfway between your heel and your shin. Take your thumb, press firmly into the skin just above that bone, and hold for a full 5 seconds. 1, 2, 3, 4, 5. Now lift your thumb and look. If the skin springs right back with no mark at all, that is a 0. No significant fluid. If there is a slight dent, maybe 2 millimeters deep, and it fills in within a couple of seconds, that is a grade 1. Trace edema. If the dent is deeper, 3 or 4 millimeters, and it takes 10 to 15 seconds to fill back in, that is a grade 2. Mild edema. That is where most people over 60 land. That is where the trouble starts. Grade 3 is a deeper pit, 4 to 6 millimeters. It takes 30 seconds to a full minute to rebound. Grade 4 is a crater, 6 to 8 millimeters deep, and it can take 2 to 5 minutes to disappear. Numbers in the range researchers associate with grade 3 or 4 warrant a conversation with your doctor this week, not next month. Post your number in the comments right now. Grade 0, 1, 2, 3, or 4, whichever it is. Follow along through this video. Try the protocol at the end for 14 days. Then do the thumb test again and post your new number. That before and after will tell you more about what is actually happening in your legs than most of the blood work you have ever had done. Now here is something the research on aging keeps confirming and almost nobody talks about. Your legs have a second heart. Not literally, but functionally. It is your calf muscles. Every time your calves contract, when you walk, when you climb stairs, when you shift your weight from one foot to the other, they squeeze the deep veins running up the back of your leg. That squeeze pushes blood upward against gravity. The valves inside the veins snap shut behind it. The blood cannot fall back down. Your heart pushes blood down to your feet. Your calves push it back up. That is the whole system. After 60, that system breaks down on both ends. The valves weaken and stop closing all the way. And the calf muscles lose mass. From aging, from sitting more, from conditions that make walking harder. Researchers evaluated patients at an average age of 64 and found that more than 60% had measurably reduced calf pump function. Weak pump, leaky valves. That is what is trapping fluid in your ankles, not your heart, your legs. But here is where the research gets uncomfortable, and where most videos on this topic stop short. There is one more cause of ankle swelling in adults over 60 that is more common than all of these combined. It is not a disease, it is not a condition. It is something you may already be putting into your body every morning, and nobody has connected it to your ankles. Before we get there, look at a case that shows up again and again in the clinical literature. Margaret is 68, retired teacher. About 8 months ago, she noticed her ankles looking fuller by dinner time. Her shoes felt tighter. She mentioned it at her annual physical. Her doctor listened to her heart, ran blood work. Everything came back normal. She was told to elevate her feet and cut down on salt. 3 months later, the swelling was worse. She started noticing a brownish discoloration on the skin around both ankle bones. The skin felt thicker, almost leathery. She went back. This time, a different doctor saw her, and this doctor asked one question the first one had not thought to ask. When did you start your blood pressure medication? 8 months ago. The exact same time the swelling started. Margaret had been put on amlodipine, one of the most widely prescribed blood pressure medications in the country. Ankle swelling is one of its most common side effects. It is right there on the prescribing information, but nobody had mentioned it to her, and nobody had connected the timing. Worse, her first doctor had been about to prescribe a water pill, a diuretic, on top of the amlodipine, to treat a symptom the amlodipine itself was causing. That kind of chain reaction has a name in the medical literature. Doctors call it a prescribing cascade, and the research suggests it happens far more often than anyone wants to admit. The second doctor switched Margaret to a different class of blood pressure medication. Within 3 weeks, the swelling dropped by half. A venous ultrasound confirmed she also had moderate insufficiency in both legs, which had been developing quietly for years. She started daily calf exercises, elevation, and compression stockings. 3 months later, the swelling was under control. This is the part that stays with people who read the case reports. If nobody had ever caught the medication connection, that brownish discoloration would have kept progressing. The next stop is venous ulcers, open wounds near the ankle that take months to heal and often come back. Nobody had told Margaret. She lost 8 months. Now, before we go into the countdown, 3 things you may have been told about ankle swelling that the research does not support. Myth: swollen ankles almost always mean your heart is failing. False. Venous insufficiency is roughly 30 times more common than heart failure in adults over 60. Statistically, if your ankles are swollen and both sides look the same, your veins are far more likely to be the cause than your heart. Your doctor should be checking the veins in your legs before assuming the heart is the problem. Myth: a water pill will fix ankle swelling, no matter what caused it. Not quite. When ankle swelling is caused by a medication that widens the arteries without widening the veins to match, which is exactly what amlodipine does, the problem is not that you have too much fluid in your body. The total volume is unchanged. Fluid has just been pushed out of the vessels and into the tissue. A diuretic pulls fluid out of the vessels you already have. It does not address the redistribution. It can, however, cause dehydration, kidney strain, and falls. Myth: if the swelling goes down overnight, it is nothing to worry about. The opposite is true. Swelling that improves lying down and worsens standing up is the textbook signature of venous insufficiency, the most common cause. Untreated, chronic venous insufficiency progresses in stages: swelling first, then brownish discoloration, then thickening of the skin, then open wounds. The progression is stoppable, but only if you act while it is still in the earlier stages. Here is what that means for you, specifically. 5 hidden causes of ankle swelling after 60, in reverse order. None of them are your heart. Number 5. Low protein in your blood. You know how a sponge that has dried out will not hold water anymore? Something similar happens inside your blood vessels. The main protein in your blood is called albumin. It acts like a sponge that keeps fluid inside your blood vessels through a force called osmotic pressure. When albumin drops, from poor nutrition, chronic illness, liver disease, kidney disease, or long-term inflammation, the sponge dries out. Fluid leaks through the vessel walls into the surrounding tissue. Your ankles are the lowest point on your body when you are upright. That is where it collects. A simple blood test picks this up. Many doctors order it routinely, but almost none of them explain what a low result means for your ankles. If you have had blood work done in the last year, dig it out and look for the word albumin. Your report will have a normal range next to the number. If your number is in the lower part of that range, or below it, that is worth asking about specifically. Ask your doctor, could my albumin be contributing to my ankle swelling? What can I do about it? Number 4. Your thyroid. Do the thumb test again in your head. Think about what the dent looked like. If the skin sprang back almost immediately, and the swelling felt firm and doughy rather than soft, that is a different kind of edema. Doctors call it non-pitting. It points at a different organ, your thyroid. When the thyroid is underactive, it slows the breakdown of certain large sugar-based molecules in your connective tissue. Those molecules act like microscopic sponges. They trap water and hold it tightly in the tissue underneath the skin. The result is a firm, puffy swelling that shows up in the ankles, the face, and the hands. The medical name is myxedema. A single blood test, your TSH level, will catch this. If your ankle swelling does not pit when you press on it, and you have been feeling colder than everyone else in the room, more tired than the amount of sleep you are getting, or gaining weight in a way that does not match how much you are eating, ask for a TSH. It is one of the cheapest and most useful blood tests in medicine, and it is dramatically underordered in adults over 60. Women in particular are far more likely to develop an underactive thyroid after menopause, and the symptoms are often written off as normal aging. Number 3. Your lymphatic system is slowing down. Most people have never thought about their lymphatic system. It runs alongside your veins as a second drainage network, collecting the fluid your veins do not catch and returning it to the bloodstream. Lymphatic vessels have their own tiny muscles that pump this fluid upward, back toward the chest. That pumping action slows down with age. Some research puts it at roughly 38% slower in older adults. The lymphatic vessels themselves become stretched out and lose some of their contractile power. And when the lymphatic pump slows down and the venous system is already leaking, the fluid your veins cannot handle has no backup network to move it out. The scale of this is not small. Lymphedema prevalence roughly triples between the general adult population and people over 65. It rises further in people over 85. Most doctors never check lymphatic function at all. It is not a standard part of any exam. There is no blood test for it. There is no scan they routinely order. So if you have been told your ankle swelling is just a mystery and everything else has been ruled out, this is worth asking about specifically. Ask your doctor whether your lymphatic drainage could be part of the picture. Number 2. Sleep apnea. This one catches people off guard. Think about your mornings. Do you wake up already feeling like you did not really sleep? Do you nod off in the afternoon watching television, even though you were in bed for 8 hours? Does your partner nudge you at night to change position because you have gone quiet in a way that does not feel like normal sleep? Do you snore loudly enough that someone has moved to a different room? If any of that sounds familiar, Your ankle swelling may be connected to something happening in your lungs at 3 in the morning. When breathing repeatedly stops and starts during sleep, pressure builds up in the blood vessels of the lungs. Doctors call it pulmonary hypertension. It strains the right side of the heart, and when the right side of the heart is strained, it has trouble pulling blood back from the legs. The result is bilateral ankle swelling with a heart that looks perfectly normal on every standard test. The research suggests that roughly 1 in 5 people with sleep apnea develops this pattern, and sleep apnea itself is widely underdiagnosed, particularly in women. Here is the encouraging part. When sleep apnea is treated with CPAP therapy, the ankle swelling often resolves entirely. If you have unexplained ankle swelling and any of the sleep symptoms above, ask your doctor about a sleep study. Which brings us to number 1. This is the one I said would change how you think about all of this. And it will. Number 1. The medication your doctor prescribed to help you may be the thing causing this. This is the cause almost nobody suspects, because it feels like a contradiction. Your doctor gave you a pill to protect your health, and that pill is quietly pooling fluid in your ankles. It is not a defect. It is not an allergy. It is a known, predictable side effect that shows up in the drug's official prescribing information. Most patients are never told about it. And when the swelling shows up weeks or months after starting the medication, most doctors do not connect the two. Roughly 1 in 10 adults over 60 who start a calcium channel blocker like amlodipine will develop ankle swelling within a year. At higher doses, some studies report rates approaching 50%. The mechanism is not water retention. The drug widens the small arteries but does not widen the veins to match. Pressure builds up at the capillary level. Fluid gets pushed into the tissue. A diuretic will not fix it, because the total amount of fluid in your body has not gone up. It has just been redistributed. And it is not only blood pressure pills. Gabapentin, the 5th most prescribed drug in the United States, used for nerve pain, neuropathy, and a growing list of off-label conditions, causes ankle swelling in about 1 in 20 patients. A study of older veterans who developed swelling after starting gabapentin looked at how often the prescribing doctor recognized the medication as the cause. The answer was 4%. 4%. In 60% of those cases, the doctor who prescribed the gabapentin was not even the same doctor who later prescribed a diuretic to treat the swelling it had caused. That is a prescribing cascade. Pill 1 causes swelling. Doctor does not connect the two. Pill 2 gets added. Pill 2 causes kidney strain, electrolyte drops, dizziness, falls, and the swelling never really goes away because nobody addressed the actual cause. If your ankle swelling started or worsened within days or months of beginning any new medication, that medication is the first thing to investigate. Before the cardiac workup, before the ultrasound, before a single water pill, talk to your prescribing doctor. Do not stop any medication on your own, but make sure that conversation happens. Here is one more number the research shows that most doctors never mention. Chronic venous disease now affects an estimated 190 million Americans. That is more people than every cardiovascular disease combined, and more than 5 times the population living with diabetes. And yet it receives a fraction of the research funding, the public awareness, and the clinical time. That gap between how common this problem is and how little it is discussed is exactly why your ankles have been swelling without a real answer for months or years. How old are you? Write your age in the comments. The research is very clear that the risk of chronic venous insufficiency roughly doubles every decade after 50. The same swelling at 55 and at 75 carries very different urgency. Your age will help the people reading these comments get a sense of the shape of this in the real world. Who is dealing with what, and when it started. Drop your age below. It matters more than you might think. Now, the protocol. If your thumb test came in at a grade 1 or 2, following this consistently for 14 days should produce a measurable change. Talk to your doctor before starting, particularly if you have any heart, kidney, or arterial disease. The ankle reset protocol. Step 1, the medication check. Before anything else, look at every pill you take, prescription and over-the-counter. Write down the name of each one and roughly when you started it. Bring that list to your next appointment and ask one specific question. Could any of these be causing my ankle swelling? Flag any calcium channel blocker, amlodipine, nifedipine, and similar drugs. Flag gabapentin or pregabalin. Flag any regular use of ibuprofen or naproxen. Flag any steroid. This one step catches the most common missed cause. Step 2. The calf pump reactivation. Twice a day, do 20 slow calf raises. Stand behind a chair. Hold the back lightly for balance. Rise onto your toes. Hold for 2 seconds. Lower slowly. 20 repetitions. Structured calf exercise has been shown in randomized trials to measurably improve venous pump function, even in older adults with existing insufficiency. Step 3. Elevation with intent. 3 times a day, 20 minutes at a time. Get your feet above the level of your heart, not ankle height on an ottoman. Above your heart. Lie back on the couch or the bed with your legs propped on 2 or 3 pillows. Gravity is what is trapping fluid in your ankles. Elevation reverses it. Step 4. Graduated compression. If your doctor confirms your arterial circulation is adequate, ask about Class 2 compression stockings, 20 to 30 millimeters of mercury. Put them on first thing in the morning, before your ankles have had time to swell. That is when they work best. Compression supports the weakened valves and helps the calf pump move blood upward more efficiently. The evidence for compression in chronic venous insufficiency is strong. Step 5. The retest. 14 days from now, do the thumb test again. Same ankle, same spot, same 5-second press. If your grade has dropped, the protocol is working, and the primary cause was likely mechanical. The veins, the pump, or a medication that is now under review. If your grade has not changed, that is important information too. It points at something the research would call deeper: thyroid function, albumin, sleep apnea, or a venous duplex ultrasound. Either way, you now have data, and data drives a different conversation with your doctor. Then keep an eye on it. One thing worth mentioning to your doctor if you have chronic venous insufficiency. Horse chestnut seed extract has been studied in multiple clinical trials for this exact condition and has shown modest reductions in leg swelling. It is not a replacement for compression, exercise, or medication review. The evidence is stronger for standardized preparations than for over-the-counter formulations. Ask your doctor whether it makes sense for your situation. Do not start it on your own. Go back to that number, the grade you wrote down in the comments at the start of this video. That number belongs to you. It tells a story about what has been quietly happening in your legs while everyone was checking the wrong organ. The protocol you just heard is the start of a different story. 14 days from now, test again. Post the new number. See what the change looks like. 5 years from now, the people who did the calf raises, wore the compression, and had the medication conversation will still be walking their grandchildren to the park without thinking about their ankles. The people who dismissed it as just aging will be dealing with skin breakdown and wounds that will not heal. That window is open right now. It does not stay open forever. Every week, Inside Aging goes through the research that sits in medical journals and never makes it into the 15-minute appointment. The findings that change how you understand your own body after 60. The information nobody told you because nobody had time. If that is what you have been looking for, subscribe. Every video is built around what you actually need to know. And if someone you love has been dealing with swollen ankles and has not been given a real answer, send them this video. That could be the thing that finally gets them the right diagnosis.